Look down at your feet right now. If you're over 60, what you see in the next 10 seconds could tell you something your last blood test completely missed. Because there are 3 changes that can appear on your feet, quietly, gradually, almost invisibly, long before any doctor ever flags your blood sugar as a problem. Not on your face, not on your hands, on your feet, in the one place most people never think to check. By the time most people notice, their blood sugar has already been running dangerously high for months, sometimes years. And the unsettling part is how easy these 3 signs are to dismiss. A little discoloration, a strange tingling, a crack that won't close. Most people blame their shoes, their age, dry weather, or a long day on their feet, anything except what's really happening underneath the surface. Stay with me for the next 20 minutes because I'm going to walk you through what these 3-foot changes look like, why they happen inside your body, and what you need to do the moment you spot even one of them. I'll also share 3 real stories of people who ignored these signs at first and what happened once they finally paid attention. This is Dr. Lumiva, and this is information that could change how many more years you spend walking on your own 2 feet. Before we get into the first sign, I want you to understand one thing clearly. Your feet are, quite literally, the furthest point from your heart. That means they are the first place in your entire body where circulation problems and nerve damage tend to show up, and the last place where blood reaches when something starts to go wrong internally. That's why doctors who specialize in diabetes call the feet a window into what's happening with your blood sugar, sometimes years before a routine checkup would ever catch it. Let's start with the first sign, and it's one that catches almost everyone off guard: a change in the color of your toes or the skin across the top of your foot. Harold was 71 years old, a retired mail carrier who'd spent 4 decades on his feet, delivering letters door to door in every kind of weather. He figured his feet had earned every ache and every strange sensation they gave him over the years. So when he noticed his big toe had taken on a faint bluish-purple tint one winter morning, he assumed it was simply poor circulation from the cold, the same thing he'd dealt with dozens of times during his career. He pulled on a thicker pair of wool socks and went about his day without a second thought. 3 months later, that same toe still hadn't returned to its normal color. If anything, the discoloration had crept toward his second toe as well, and both toes had taken on a dusky, almost purplish tone that no amount of warm socks seemed to fix. His daughter noticed it during a visit home and finally convinced him to see a podiatrist. The podiatrist took one look, asked him a handful of pointed questions about thirst, fatigue, and how often he'd been getting up at night to use the bathroom, and sent him straight to his primary doctor for blood work. His fasting glucose came back at 231. His A1C, which measures average blood sugar over roughly 3 months, came back at 9.4. Harold had been living with undiagnosed type 2 diabetes for what his doctor estimated was at least 2 years, possibly longer. Here's why this happens inside the body. When blood sugar stays elevated for extended periods, it damages the walls of your smallest blood vessels, the tiny capillaries that carry oxygen-rich blood to the furthest points of your body, which happen to be your toes and the outer edges of your feet. This vascular damage is called peripheral arterial disease, and in people with elevated blood sugar, it tends to develop far earlier and far more aggressively than it would from age alone. As these small vessels narrow, stiffen, and lose their elasticity, less blood is able to reach your extremities with each heartbeat. The visible result is a shift in skin tone, toes that turn pale, dusky red, or bluish, especially when your foot is elevated, when the room is cool, or after you've been sitting still for a stretch of time. What makes this sign so deceptive is that it often comes and goes at first, which is precisely what happened to Harold. You might notice it one evening, and then it seems to fade by the next morning, so you write it off as nothing more than a temporary reaction to temperature. But that inconsistency is actually part of the warning, not a reason to dismiss it. Healthy circulation simply doesn't fluctuate that dramatically from 1 hour to the next. When your blood vessels are already struggling to deliver adequate blood flow, even small changes in temperature, elevation, or activity level can trigger visible, noticeable color swings that a person with normal circulation would never experience. There's a simple test you can do at home tonight, and it takes less than 2 minutes. Sit down comfortably, prop your foot up above the level of your heart, and hold it there for about a minute. Watch the color closely. Healthy feet stay a consistent, even pink tone throughout this test. If your foot turns noticeably pale, white, or waxy while elevated, and then flushes an unusually deep red or purple once you lower it back down to the floor, that's a sign your circulation is already compromised. And in someone over 60, elevated blood sugar sitting quietly in the background is one of the most common underlying causes of that kind of vascular damage. One more detail worth mentioning: pay attention to temperature as well as color. If one foot consistently feels noticeably colder to the touch than the other, that's often tied to the same reduced blood flow that's causing the discoloration, and it's worth mentioning to your doctor alongside anything you notice visually. Color change is the first clue your body gives you, and it's often the easiest one to catch simply by looking. But the second sign doesn't show up on the surface at all. It shows up in what you feel, or more precisely, in what you slowly stop feeling without even realizing it. The second warning sign is numbness, or a persistent tingling sensation, often starting in the toes and gradually spreading toward the sole of the foot and sometimes up toward the ankle. Diane, 64, had always prided herself on her balance and her light step. She'd taken ballet lessons as a girl and still moved with a dancer's grace well into her 60s, something her friends often complimented her on. So when she started noticing a strange pins and needles sensation in both her feet, particularly in the evenings while she sat at her sewing table, she chalked it up to sitting too long in one position. It seemed harmless enough, the kind of thing anyone might feel after a long afternoon of hobbies. She didn't think much of it at all until the day she stepped on a sewing needle that had fallen onto her carpet and didn't feel a thing. She only discovered the injury later that evening, when she noticed a small spot of blood soaking through her sock. That moment shook her enough to finally book a doctor's appointment. Her doctor performed a simple test using a thin nylon fiber called a monofilament, gently touching it to several specific points across the bottom of each foot to check how well she could sense light pressure. Diane could barely detect the touch on 3 of the 5 test points on her left foot and 2 of the 5 on her right. Blood work confirmed what her doctor already suspected based on the exam alone. Her A1C came back at 8.9, comfortably into diabetic range, and she had already developed a condition called peripheral neuropathy, meaning nerve damage caused by prolonged exposure to high blood sugar. This is one of the more insidious aspects of elevated blood sugar. Glucose, when it circulates in excess for months or years, doesn't just damage blood vessels the way we discussed with the color changes. It also damages the nerves themselves, particularly the long, thin nerve fibers that travel all the way down from your spine to your feet. Because these are the longest nerve pathways in your entire body, they are typically the first to show measurable damage when blood sugar has been running high over an extended period. Doctors often describe the resulting pattern as a stocking distribution because the numbness tends to spread in roughly the shape a sock would cover, starting at the very tips of the toes and gradually working its way upward toward the ankle and sometimes the shin. The truly frightening part isn't the tingling sensation itself, uncomfortable as it can be. It's what that tingling eventually becomes: full numbness. And numbness means you lose one of your body's most important early warning systems. A pebble stuck inside your shoe, a blister forming from a seam rubbing the wrong way, a small cut from stepping on something sharp in the grass. All of these should hurt just enough to make you stop, take off your shoe, and check what's going on. But once meaningful nerve damage sets in, your feet stop reliably sending those signals to your brain, which is how small, manageable injuries turn into major complications without anyone noticing until it's far too late to catch early. Try this simple check tonight before bed. Close your eyes and, using either a cotton ball or just the tip of your finger, run it lightly across the bottom of each foot, section by section, heel, arch, the ball of the foot, and each individual toe. You should be able to clearly and immediately feel the touch everywhere along the way. If certain areas feel muted, distant, delayed, or as though you're sensing the touch through a thick sock even though your skin is bare, that's your nervous system quietly telling you something your last round of blood work may not have caught yet. It's also worth noting that this kind of neuropathy doesn't always announce itself as numbness alone. Some people describe it instead as a persistent burning sensation, especially at night, or a feeling similar to walking on sand or gravel, even while standing on a flat, smooth floor. If any of these descriptions sound familiar, it's worth mentioning specifically to your doctor, because the exact wording can help guide which tests they order. Numbness robs you of your body's built-in alarm system, and that sets the stage perfectly for the third sign, the one that tends to show up only after the first two have already gone unnoticed for a while. The third sign is a wound, crack, or sore on your foot that refuses to heal even after several weeks of basic care. Frank was 68, a retired contractor who'd built houses with his own two hands for most of his working life. Rough, calloused skin and small cuts were nothing new to him. He'd always healed fast, a trait he'd been almost proud of throughout his career. So when a small crack appeared along the edge of his heel, he treated it the way he always had, a bit of antibiotic ointment, a bandage, and he kept moving through his day without giving it much more thought. Except this time, 3 weeks passed and the crack hadn't closed at all. If anything, it had widened slightly, and the skin surrounding it had taken on an unusual, angry shade of red. His wife noticed it before he did, catching sight of his heel one evening while he was putting on a fresh pair of socks. She insisted, not for the first time, that he finally see a doctor about it. What Frank learned that day rattled him more than he expected. Chronically elevated blood sugar feeds the bacteria that cause infection while simultaneously slowing down the body's ability to repair damaged tissue. His wound wasn't healing because his circulation was already compromised in the same way we discussed earlier, and his immune response was operating at a fraction of its normal strength. His doctor diagnosed him with type 2 diabetes on the spot, with a fasting glucose reading well over 200. This is where the first two signs and the third one connect. Each makes the next one worse. Poor circulation, the kind we talked about with the color changes in his toes, means less oxygen and fewer healing nutrients ever reach the site of a wound like Frank's heel. Nerve damage, the kind we covered with the numbness, means a person might not even feel the wound forming in the first place, or feel the pain that would normally push someone to treat a small crack seriously before it worsens. Add to that a third factor. Elevated blood sugar creates an internal environment where bacteria multiply more easily, while white blood cells become measurably less effective at fighting infection. 3 problems, stacked on top of each other. Put them together, and a small crack on someone's heel can spiral into what doctors call a diabetic foot ulcer, one of the leading causes of lower limb amputation in people over 60. I'm not sharing that statistic to frighten you for its own sake. I'm sharing it because it explains why catching this third sign early matters as much as it does. A wound that hasn't shown meaningful improvement after roughly 2 weeks isn't just stubborn skin, and it isn't something to keep managing on your own indefinitely. It's a signal that something deeper is interfering with your body's normal healing process, and in someone over 60, chronically elevated blood sugar sits at the very top of the list of likely underlying causes. Check your feet tonight under good, bright lighting, including the bottom of your heels, the space between each toe, and the sides of your feet where shoes tend to rub. These are the areas people miss most often simply because they're awkward to see without deliberately looking. If you find any crack, sore, or blister that's been present for longer than 2 weeks without real improvement, that's not a job for another round of home remedies. That's a conversation to have with your doctor this week, not sometime next month when it's convenient. You might be wondering why the feet, out of every part of the body, tend to show these warning signs first. It isn't random. Understanding the reason makes it much easier to remember what to watch for. Blood has to travel further to reach your feet than almost anywhere else in your body. Every heartbeat pushes blood outward from your chest, down through your legs, all the way to the tips of your toes, against gravity for most of the day while you're upright. That's a long, demanding journey. It means your feet depend on your circulatory system working efficiently from top to bottom. When blood vessels anywhere along that path begin to narrow or stiffen from years of elevated glucose, your feet feel the shortfall first because they sit at the very end of the line. The same logic applies to your nerves. The nerve fibers that control sensation in your toes are the longest in your entire body, often stretching 3 feet or more from your lower spine down to your toes. Long structures are more vulnerable to gradual damage than short ones. Think of a long extension cord. It's more likely to develop a weak spot somewhere along its length than a short one plugged directly into the wall. That's part of why neuropathy so reliably starts at the toes and works its way upward. Your feet also absorb more daily wear than almost any other part of your body. Walking, standing, the ordinary pressure of your own body weight, feet take on constant friction and minor trauma that skin elsewhere rarely faces. When healing capacity is already compromised by elevated blood sugar, the feet end up revealing the problem first. They're simply the part of the body most likely to sustain small injuries in the first place. Three factors, one pattern: the longest circulatory path, the longest nerve fibers, and the heaviest daily wear. Together, they explain why doctors so often describe the feet as an early warning system for blood sugar problems that haven't shown up anywhere else yet. I want to share one more story because it illustrates just how quickly these three signs can compound into something serious when none of them are caught in time. Eleanor was 66, recently retired from a long career as a school librarian and looking forward to finally having time for the garden she'd always wanted. Over the course of about 4 months, she noticed all three signs I've described today, one after another, without ever connecting them. First, a faint discoloration in her toes that she blamed on new shoes. Then, an occasional tingling in her feet in the evenings that she attributed to standing in the garden longer than usual. Finally, a small cut on the side of her foot from a garden tool that simply wouldn't close. By the time Eleanor finally saw a doctor, prompted by a fever that alarmed her enough to seek care, the cut on her foot had become infected. Her fasting glucose that day came back at 268. She was hospitalized for 4 days to bring the infection under control with intravenous antibiotics, and her doctor told her plainly that the outcome could have been dramatically different and far more serious if she had waited even a week or two longer. Eleanor's story isn't meant to scare you into panic. It's meant to show you what happens when all three signs are allowed to build on top of one another without anyone stepping in early. Her recovery, once she committed to consistent treatment and closely monitoring her blood sugar, went smoothly. But she's told friends since then that she wishes someone had explained these three warning signs to her months before that fever sent her to the emergency room. Here's what makes these three signs so important when you look at them together instead of one at a time. Individually, each one is remarkably easy to explain away. Cold weather causes toe discoloration. Sitting too long causes a bit of tingling. Rough, dry skin causes a slow healing crack here and there. Nobody panics over any single one of these signs on its own, and that's precisely why elevated blood sugar goes undiagnosed in so many people well into their 60s and 70s, sometimes for years at a stretch. But when you notice two of these signs appearing together, or even just one that persists stubbornly for more than a couple of weeks, your body isn't giving you a coincidence. It's giving you a pattern, and patterns like this typically don't appear out of nowhere. They tend to show up only after blood sugar has already been elevated for a meaningful stretch of time, often long enough for early nerve and vessel damage to have already begun beneath the surface. The reassuring part in all of this is that none of it means the damage is permanent or that your future has already been decided for you. Blood sugar that's caught and properly managed early, even after some nerve or circulation changes have already started, can often be stabilized enough to prevent the underlying condition from progressing any further. Many of the people whose stories I've shared with you today went on to manage their diabetes successfully once they finally had a clear diagnosis in hand, instead of a collection of unexplained symptoms. Harold's circulation improved noticeably within about 6 months of starting treatment and adjusting his diet. Diane regained a meaningful degree of sensation in her feet after her blood sugar came under consistent control. Frank's heel healed completely within a matter of weeks once his glucose levels finally stabilized under his doctor's care. Before we get to what you should do next, it's worth understanding who tends to be most vulnerable to these three signs. Certain factors make elevated blood sugar far more likely to show up in the feet first, and far more likely to be missed until it's advanced. Age plays a role. Blood vessels and nerves naturally lose some resilience over the decades, which makes them more susceptible to damage from elevated glucose than they'd have been at 30 or 40. That's part of why these signs cluster so heavily in people over 60, even when a younger adult might show a similar blood sugar reading on paper. Occupation matters too. People who've spent years standing or walking extensively for work, the way Harold did delivering mail or Frank did on construction sites, often struggle to tell early neuropathy or circulation changes apart from ordinary occupational wear and tear. Sore, tingling, or discolored feet already felt like a normal part of the job long before blood sugar entered the picture. That overlap is exactly why so many people in physically demanding careers end up with a delayed diagnosis. Family history matters as well. If a parent or sibling has dealt with type 2 diabetes, your own risk rises, and that risk compounds with age. If that description fits you, treat any of today's three signs with a bit of extra seriousness, rather than assuming they'll resolve on their own. And one more thing worth flagging. If you haven't had a fasting glucose or A1C test within the past year, that alone is reason enough to schedule one, whether or not you've noticed any of these three signs. Blood sugar can climb for years without producing a single symptom until nerve or vessel damage has already begun. Relying on symptoms alone without periodic testing leaves a wide window for the condition to progress unnoticed. So here's exactly what I want you to do, starting today, not next week. First, run through the 3 checks I walked you through: the elevation color test, the barefoot sensitivity check with a cotton ball or fingertip, and a full visual inspection of both feet under good lighting. Write down anything unusual you notice, even if it seems minor or easily explained away, so you have specific details ready to share with your doctor rather than a vague memory of something felt off. Second, if you notice any of these 3 signs, don't wait for your next scheduled physical to bring it up. Call your doctor's office this week and specifically mention what you found. Ask for a fasting glucose test or an A1C test, and ask them to check your circulation and nerve sensitivity in your feet as well while you're there. These are simple, inexpensive, and widely available tests that can catch a developing problem years before it has the chance to become genuinely serious. Third, make foot checks a permanent part of your daily routine going forward, the same way you might already check your blood pressure or step on a bathroom scale. 30 seconds each evening, right before bed, is truly all it takes. For anyone over 60, that small, almost effortless habit could end up being the difference between catching a problem early enough to reverse course and discovering it only after real, lasting damage has already been done. Fourth, if you're already living with a diabetes diagnosis, don't assume these checks no longer apply to you simply because you're already under a doctor's care. Harold, Diane, and Frank all had this in common. Their damage built up during the years before diagnosis, but small changes can still develop even after treatment starts if blood sugar drifts upward again. Continuing these same nightly checks, even once you're being actively managed, gives you and your doctor an early signal if your current treatment plan ever needs adjusting. And fifth, keep proper footwear in mind as part of your prevention strategy, not just an afterthought. Well-fitted, supportive shoes reduce the friction and pressure points that so often turn into the slow-healing wounds we discussed with Frank and Eleanor. Avoid walking barefoot, even at home, if you've noticed any numbness or tingling in your feet, since reduced sensation makes it far too easy to step on something sharp without realizing it until later. Your feet have been carrying you for 60, 70, maybe even 80 years by now. They've earned 30 seconds of your attention tonight. If this video helped you understand something new about your own health, or gave you a reason to look more closely at your own feet this evening, do me a favor and subscribe to this channel. I share information like this every single week, the kind that could help you or someone you love catch a serious problem while there's still plenty of time to act on it. Think of someone whose feet you'd want to check on, a parent, a spouse, an old friend who's always on their feet. Send them this video today. It might be the nudge they need to finally look down and pay attention to what their own body has been trying to tell them before a fever or an infection forces the issue the way it did for Eleanor. Remember, none of these 3 signs on their own mean you're facing something irreversible. What they mean is that your body is asking for a conversation with your doctor sooner rather than later. That conversation and a simple pair of blood tests is a small price to pay for catching a problem while there's still every reason to expect a full recovery. Take care of yourself, and I'll see you in the next one.